Hey there, Dr. Todd Cameron here. By now you'll be aware that ATAGI and the TGA have approved vaccines for children aged 5 to 11 for COVID prevention. And this vaccine is the Pfizer vaccine that has been approved initially at least, and others may come later. It's really important to recognise that this vaccine is 1/3 of the dose of the vaccine that is given to adults and children 12 and above. The reason for that is the immune system in children between age 5 and 11 is quite different. It's pretty well supercharged, and so they don't require the same dose to get the same effective immunity. It is 2 doses. At this point in time, it is 8 weeks apart. There may be circumstances, though, where the federal government may choose to shorten the duration between those 2 vaccines, and that would be decided by ATAGI. So keep your eye on the news if there's any change to that. The safety data is excellent for children aged 5 to 11, and you will see some linked documentation around this video. Please go and have a look at that, but the risk and reward ratio is well on the favour of the risk, according to the experts in this space. It's really important that you actually plan a time to get the vaccine. If you have any questions about the vaccine or your circumstances being different, or you have any concerns whatsoever, you should have a conversation with your GP prior to attending the vaccine clinic. The vaccine clinic is a really fast moving clinic because we want to get through the largest number of people that we can in the shortest amount of time, just so we can make the biggest impact on the community that is possible. So any questions, you need to make sure they're answered through the government documentation or a conversation with your GP. Obviously, all patients must have a guardian that attends with them, and you should be planning for probably having them in your lap. All guardians should make sure that they attend wearing a well-fitting face mask, and they should have a valid Medicare card. We can only immunise people that have a valid Medicare card, and only people in the eligible date range between age 5 and 11. Now, if you turn 12 between the time that you receive your first dose and your second dose, then the current advice is that the second dose should be the adult dose, but that's not a big deal. We'll worry about that if that concerns you. Otherwise, I want you to make sure that you book an appointment. If you sound like you're ready to do that, you do that through HotDoc in our case, and you'll see the booking links available below this video. We'll see you there. Bye.